Hello everyone and welcome to today's webinar, How to Use the Kidney Community Kitchen Meal Planner. We are offering this webinar bilingually using simultaneous translation. If you would like to hear the presentation in French, choose French as your language preference in the interpretation icon in the Zoom toolbar.
Nous offrons la traduction simultanée de ce webinaire de l'anglais au français. Si vous souhaitez entendre la présentation en français, choisissez votre langue préférée dans l'icône d'interprétation de la barre d'outils Zoom.
I'm Lydia Lauder, the National Director of Programs and Public Policy at the Kidney Foundation. The land I'm standing on today is in the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. The information shared in today's webinar is current as of today, September 22nd, 2021. The material shared in this presentation is not intended to be medical advice. You should speak to your doctor about your own individual situation. This information is intended for a Canadian audience. We are thrilled to introduce our speakers. Thank you all for making the time to share this important information today. We have a lot of content to cover, so please visit our website to read their complete bios. David Flexer is a project manager, consultant, and web developer specializing in custom WordPress development. He enjoys working in collaboration with other web professionals that bring a deep understanding of technology to solve challenges and push boundaries to meet clients' needs. David developed the Kidney Community Kitchen website in collaboration with designer Mike Herdigan of sprucepot.com and with data specialist Andrea Battaglia of Audacious to build the meal planner. David has worked with the Community Kitchen since 2016. June Martin has been a nephrology dietitian for over 20 years. She's the past president of the Canadian Association of Nephrology Dietitians and is part of the team that developed the Spice It Up series of cookbooks. She's an active volunteer for the Kidney Foundation in Canada and has helped in the development of the Kidney Community Kitchen. I'll hand it over to you, June. Thanks a lot.
Thanks, Lydia. I'm excited to be here and talk about meal planning for kidney patients. So before David jumps in and teaches us all about the new meal planning tool, I just wanted to spend a couple minutes talking about why meal planning is such a great idea. Next slide, please. So there are many, many benefits for everyone of meal planning. First of all, it saves you time. When you know what you're going to eat, you're not spending all your time trying to figure it out. It saves money. The more planning you do, the less likely you are to buy fast food on your way home or rely on convenience foods. And you can plan in advance and make sure that you are utilizing all your ingredients to the best of your abilities. It reduces food waste. I don't know about you, but I know that I certainly, especially when fresh fruits and vegetables are in season, I buy so much and end up wasting some because I can't, I don't have a plan for them. So if you plan your meals around your ingredients, then you're definitely going to reduce food waste. And it's also important as a kidney patient for you to think about your specific nutritional needs. Meal planning is going to make sure that you are getting adequate protein and that you're not overdoing any specific nutrients. So that's what's exciting about the KCK Meal Planner, is that you're going to get your specific nutritional needs and you're going to be sure that you're getting everything that you need and not too much of anything. Next slide, please. Okay, so these are the main tips. We always suggest look through your pantry, take stock. What do you have on hand? And if you can, plan your meals around what you already have. This is especially important if you have foods that are maybe close to going bad. You can use them early in the week, or if you have things that are going to expire, you can use those as well before that happens. Also important to make a list, and this is really critical. If you are like me and you go to the grocery store without a list, you will come home with everything except for the things that you need. And we always say, keep a running list. So as you utilize those pantry staples, as you finish up, the things you've always got in your pantry, you can jot them down and be sure that you're going to get them the next time you go to the grocery store. And this can be a family tool as well, as anyone in your family finishes off something that you normally have, then they can add to the list. And my children consistently try to add junk food to the list, but it is helpful when they use something that I need. We always recommend that you consider cooking once so you can eat twice. And whether that means making a big batch of something so that you can have leftovers, or being creative if you don't like leftovers. So a good example would be, maybe you're going to roast a chicken large enough to have roast chicken for dinner, and then the next day you can use the extra chicken, the leftover chicken, in something completely different, because there's a lot of people who don't want to eat leftovers. So think about how you're going to do that. And also think about the ingredients that you're buying. So if you're on the KCK website and you see something like our shrimp tacos, which are done on a tortilla, and you're only going to make maybe 4 of those, and you still have the rest of the package of the tortillas, think about maybe making some breakfast burritos later in the week. I also really recommend that you plan for snacks. It's really easy when you're out and about to kind of break down and grab something that maybe isn't the best for you. And also, if you are out and you're stuck going to a restaurant or a fast food place, the options really tend not to be ideal for kidney patients or anyone really. So having snacks on hand that are kidney friendly, that are good for you, can help you avoid falling into that trap. And then the other really critical thing about meal planning is being flexible. Just because you've made this beautiful week of meals and recipes doesn't mean you have to follow it exactly. If you plan to have a bit of an elaborate meal on a Tuesday and you get really busy, then look what else is in that week and see what you can move up. So I've heard patients say that they don't like to be, they don't know how they're going to feel. So having a variety of meals that you can move around in the week can really help you stick to a meal plan, save your money, reduce your, and not fall into the trap of grabbing fast food on your way home. And then the other thing that I think is really important when we're talking about the times we live in now, meal planning really saves you all those last minute trips to the grocery store. So I can't tell you how many times I've been in the midst of cooking a recipe and I go to grab an ingredient and I'm missing something. And we really all want to reduce the amount we're going out right now, how much exposure we're having to others. So reducing the number of trips to the grocery store is another great reason to continue meal planning. Okay, so I hope I've convinced you that meal planning is worth doing. Even if you can't do it every week, even think about trying to do it every other week. So next, I'm going to introduce David. He's going to talk to us about how to use the KCK meal planner, and we're really excited about this tool and can't wait to hear what you have to say about it.
Thank you, June. The meal planner was a fantastic project for us, to work on and to see it come to fruition. And we see it as an evolving project. We want to change and improve it to become more and more useful as we get feedback from you, the audience. We're always searching to find improved ways to present the data to you the way you want and the way you need it. Now we're going to do a quick overview. If you can get to my slide, we're just going to do a really quick overview of the 5 main parts of the meal planner. We'd like to go into details on these in the next part of our presentation. So this is the meal planner. Just an overview, and next, that it is in French. And then next, the next slide. Here we can go from week to week. So you can go to your previous weeks to take a look what you've done before. You like the recipe, you like a couple of ingredients, you remind yourself of what you've done in the past. And then we can go to the next week to plan for future items and so forth. Next slide. Here we are in French. Next slide. Here we can see the date. So we can look at the week of, so that's the beginning of the week. So this is the range. And then below in green is the day that we're on. Next. Next. And now we can tab from any given week, a chosen week, we can tab through the days and add our items to each day as we tab. Next. Next. Now, each meal plan has a block. So we'll see one for breakfast, lunch, dinner, and snack. Next. Next. And finally, on the right side, we have the nutrient analysis. The daily one is the first column, and the second will be the week. So that just concludes my really quick overview. So here we are at the meal planner, the way it shows when you're not logged in. So first, I wanted to showcase the recipes and how one goes about them, scrolling through them. First, we must log in. So we can log in from this page here or from the top at every page. Now, if you're not registered, you can still use the meal planner. But in order to save favorites, save and print your meal plan, you do need to be a member. Please consider registering. It's free, and you can apply for registration right here. So you will enter your email address as your username. And then you will log in. Now, initially, when you log in, it'll take you directly to the meal planner. But right now, I want to scroll through some recipes and take a look at the wonderful curated recipes that we have. So here we are on the home page. We can either go to the featured recipe block and browse recipes right there. These are some chosen recipes that have been chosen to be featured. Or we can go up here at the top menu under cookbook recipes. Let's click on browser. And now we have three options to browse through our recipes. We can use this filter by diet type and meal type. We can click and go directly to a chosen diet type or meal type, or we can simply scroll through the recipes. They're about 9 per page, and we can just go through the pages. At this point, I'm going to use the filter. Now, some or all of these options were available for you on every page when you're in the recipe section. So let's start with some high protein, and how about some fish today? We're going to scroll through those. We apply the filter, and we're presented with a bunch of recipes, beautiful renal-friendly recipes that are categorized as fish and seafood. So I'm going to look at this tuna macaroni, and as June pointed out, we look at what we have in our pantry. Do we have these ingredients? Are we going shopping and we'd like to purchase these? We take a look at these ingredients. We look at the directions. Is this something that we like? In this case, and as a member, by the way, you can also comment and add some of your own comments as a member of the site. In this case, I'm going to see, well, I'm not sure about pasta today. So I'm going to go to another one, and I'm going to, oh, this looks good. I've got some shrimp in the freezer that I can defrost. I'm going to take a look at this recipe. So I'm making note of the various items here, the ingredients. Yes, I've got some apples and so forth. We're going to look at the nutrient analysis for each recipe, serving size, and so forth. We can also print out this recipe in preparation for making it. Note this heart, which again only appears for members that are also logged in. By clicking on the heart, one can make it a favorite. By unclicking, you can unfavorite it. Once we favorite, it'll be available for us in the meal plan, and I will show you how to access that when we reach the meal plan, which is where we are going now. So we're going to choose today's date. Here we are on the 22nd of September. I filled in my breakfast, lunch, and snack, and I'm going to fill in some dinner items. As you can see, there is two different types of backgrounds. White are for single items, and the light blue is for recipes that have already been added to the site. So we're going to now click to add an item. So on each meal has its item, and we will start by, there's three ways that we can start searching by a single item. We can click to only view our favorites. Here is our shrimp stir fry that we've added. And we can also just search, we're looking for a steak. It'll search, and you notice again that the background is for recipes, the white is for single items. In this particular case, I think I'm going to pick that shrimp and apple stir fry and add it to my dinner. Next, I'm going to look for, I saw some nice corn. They're really great this year. And I'm going to, now note that I spelled the word corn and cob, and just see that if you just spell corn, you might get a lot of options. So as you use the meal planner, you'll be able to note that adding some more search terms will drill you down in a little better. So you can choose the portion size, and you can choose the quantity. I have a medium size, and I'm going to choose 2 for dinner. Then I would like to have an egg, a roll with my dinner, and I have an egg roll, for a dinner roll. And lastly, of course, what meal is not complete without a glass of wine? And here we are. So as you can see, we chose a recipe, and we chose some single ingredients. We multiplied some of them, and we chose the amount that we were going to use. One thing about the search that I wanted to note is that sometimes the spelling is not as expected. So for example, many people spell yogurt like this, but note that no single items show up. It means that the spelling, that the recipe is spelt this way. So it's best to, if you don't see what you're going to find, then you maybe take away some letters, and then you'll get your yogurt. Again, choose the item, add to the meal plan. Okay, so now we've chosen our items, and when we re-click on each item in the chosen meal plan, we can see a quick overview of all the nutritional analysis for this particular item, and we can remove it. In this case, I've decided, instead of having 2 ears of corn, I think I'm going to go just for 1. So I remove it, and now I'm going to add only 1. Again, I choose the medium. I've decided to add only 1. And that concludes. I've filled up my dinner, and now just some options that members will have is be able to print your meal plan. For the week. And we can move to other days. One thing I wanted to note is, as you probably noticed, there's no saving required. Once an item is added to the meal plan, it immediately gets saved. The daily nutrient analysis gets updated, and the weekly nutrient analysis gets updated for the full week. Once it's removed, the same thing. The daily will get updated and the weekly. So now we finished Wednesday. We're ready to take a look at Thursday. Perhaps we're going to use some of the leftovers for Thursday. This concludes my presentation. And I'm very much looking forward to your questions.
Thank you very much, June and David. We really do appreciate you being here today and spending some time running through the meal planner. We have had some questions starting to roll in. And one of the first questions we have here is, can we add new grocery items that are not on the database? How do we get things added to the database? For example, in BC, there's a low phosphorus oat milk available.
Would suggest that contacting through the add a recipe at this point would be a great place to start. Although Lydia, remind me, I think that requires, so contacting through the contact page, Janice will receive the email and she can contact us, and we could take a look at updating it the next iteration of the meal planner.
That's right. All she needs to do is to do that is go through the contact page, and we'll be able to follow up on her behalf for sure.
The items all come from the Canada, is it the nutritional guide? I always get the nutritional guide. And also ask it. Also we can ask the ask a dietitian question form on the website as well.
That's right. And just a reminder, we're getting lots of questions through the chat box, but it'd be great if you could put them in the Q&A box. Thanks to all the participants for that. So we've had a question, and this is probably a good one for you, June, even though I can probably speak to it as well. But is there a list of food items that may not be kidney friendly on the site?
Okay, so probably the easiest way to answer that is anything processed that has added salt and preservatives is likely not kidney friendly. So you know, anything, if you look at the FAQs in the Kidney Community Kitchen, you'll see kind of what do I do if I have stage 3 kidney disease, and it talks about that. And really we're looking at salty foods, processed foods, especially things like deli meats, processed cheeses. They have added phosphates that are tough on the kidney, and they have a lot of salt. So there's no specific list of foods that that I could print off and give you, but the bottom line is anything processed is going to be tough on the kidneys. We recommend that you choose fresh and unprocessed foods as much as possible. I hope that answered the question.
Thanks so much, June. Now, this is a question, David, for you. When you print your plan, can you print the recipe at the same time, or are they two separate actions?
That sounds like a wonderful idea for the next iteration of the site. We're very excited with these kind of questions because it gives us ideas, but currently it would be two different actions. So as you're going through adding favorites, you can print it then, and then when you get and you decide to actually eat it, you can keep a scrapbook. I do that. For recipes that I print out, but at this point it would be two separate actions. But that's a great idea.
Thank you so much. I noticed that many of the recipes are for 6 or 8 servings. This doesn't always work for someone who lives alone, and reducing often changes the taste. Would both June and David like to comment on that?
So that's true that sometimes reducing the servings can affect the taste, especially if you're doing something like a stew or a solid cut of meat where you also would need to adjust the cooking time. So it really depends on the recipe. I want to say, do we have If we don't, I think this is a great idea. The option to have cooking for 1 or 2 is one of our filters. So they would be recipes that were designed for cooking just for 1 or 2 people. But some recipes can be really easily adapted, and that might be anything that is, you know, I mentioned the shrimp tortilla pizzas. Those would not change the taste. So it's going to be mainly things that have a solid cut of meat, because the cooking time, like a roast, would be different. So that's, I think, a great point. And I think maybe we should work on adding more recipes for cooking for 1 or 2 people.
Thank you. I think that's a really good point. And yeah, oh, please
Yeah,
go ahead, David.
No, I just realized that at this point, we don't have an automatic way to reduce the portions, but that's something that we've already flagged to add to the next phase of the meal planner.
Thank you so much, David. I eat the same breakfast every day. Is there a way that I can copy it, or do I have to do each ingredient every single day?
At this point, you do have to do it every day, but that's a wonderful. We really opted to make things very simple in order to build on it. That was our goal. So that's a wonderful idea.
Absolutely. Thank you. And we have a participant trying to use the planner while we're live, so that's great. And she asked, how do I delete an item entered into the lunch or dinner box?
So here we are on our meal plan. If you click again, you get the little trash, and once you remove it, it gets deleted, and then it updates the nutrient analysis, and the weekly analysis immediately gets updated.
Well, that's very straightforward. Thank you very much. And that's certainly going to help a few people out there. June, the next couple of questions are for you. The first one is, what is an acceptable amount of sodium?
Okay, so most of us should be aiming for between 2,000 and 2,400 milligrams of sodium a day.
Thank you for that. And the next one is, what is an acceptable daily amount of potassium?
Okay, so this one, the answer is it depends. If you require a potassium restriction, depending on you, you will probably be recommended between 2,000 and 2,700 milligrams of potassium per day. So some people can maintain a perfect potassium with 2,700 milligrams a day, and others may have to be a little bit tighter, but general rule of thumb, if I was implementing a potassium restriction, I would start at about 2,700 a day. If you do not require a potassium restriction, if your potassium is absolutely normal and you've never been told to restrict your potassium, there's absolutely no reason to do so. So the normal daily recommended intake, I think, is just over 4,000 milligrams for somebody who can filter potassium easily. If you require a restriction, 2,500 milligrams is a good ballpark, but if not, there's no reason to restrict yourself.
Okay, thank you very much. Of course, it's also individual, so it's
That's
really
right.
hard to do something very generalized, but we can always give you some guides. Now I've got another question. Is there a chart with the requisite amount of nutrients available? And that kind of filters into that previous question where there is a bit of variation depending on the individual.
Okay, so I'm guessing we're talking about for kidney patients. So again, it is very individualized. So I would say check with your dietitian what your numbers should be, because just because somebody else needs 2,500 milligrams of potassium, maybe you don't. But for rules of thumb, for people who are on dialysis, you need a higher protein level than somebody who's not on dialysis, so take that into account. Sodium is pretty standard. Most people, 2,000 is generally okay, although there are some people for whom that's not appropriate. Phosphorus, we don't worry so much about a number for phosphorus anymore. This is a little bit new. We're really focusing on the kind of phosphorus that you're having, making sure it's not phosphorus from food additives. And then as far as just general nutrients, like if you wanted to know how much vitamin C or vitamin D you need as a, middle-aged woman, you can look on Health Canada's website and they have those standards there.
Okay, thank you very much. I've got another question on the nutrient analysis, and the question relates to, is the nutrient analysis based on the CAND, which is the Canadian Association of Nephrology Dietitian exchanges for items such as potassium and phosphorus, etc.?
So if we're talking about on the Kidney Community Kitchen in the cookbook where it'll say like this is 3 protein choices, then yes, that is what it is based on. But the actual nutrient analysis numbers that we get when you're calculating through the Canadian nutrient file, or it comes from the Canadian nutrient file directly. So there's no adjustment there. But yeah, with the actual when we say the portions, like this 3 protein or 2 starch or whatever, yes, those are based on the renal exchange system that comes from CAND and the Ontario Renal Network.
Okay, thank you very much. Is there a way of changing amounts? For example, I eat a quarter of a cup of blueberries, but the only option is half a cup, or I eat 6 walnut halves, but the amount is much higher. Is there a way of changing that in the meal planner?
At this point, due to we took the Canada Nutritional Guides, all of their amounts, and we only use the multiplier. We do need to find a way as quickly as possible to find increments, i.e. halves and quarters. At this point, we do not, but look for an update as soon as we are able. But it's definitely a very good point. So right now we can multiply, but we cannot reduce.
Thank you. I've had a question about how to find a dictionary for several health issues, a dietitian, and kidney disease. So there are a number of ways, and I'm happy to start this off. And June, please jump in if there's anything else I've forgotten or you'd like to add. But the Kidney Community Kitchen has an option to either ask a dietitian or to contact us with any specific questions. We'd be more than happy to answer them that way. On the website kidney.ca, there is a list of resources, an A to Z guide. There's also the option of being able to email us or contact your local branch if you have any specific questions. So don't be shy, we'd love to hear from you. There are quite a number of resources on both the kidney.ca website and the Kidney Community Kitchen website that might be able to help you. And if you can't find them, please do reach out to us. June, did you have anything to add to that particular question?
So for how to find a kidney dietitian, the easiest way is through your local kidney unit. And if most kidney clinics have renal dietitians on staff. If for some reason you're not affiliated at this point with a kidney clinic, then I would suggest going to dietitian.ca, which is the Dietitian of Canada website, and there is a Find a Dietitian feature on that website. It's available both in French and English.
Okay, thank you very much. Well, we've had quite a lot of questions come through, so that's been fantastic. Our people behind the scenes, Chantel's been quite furiously typing a number of websites there. So if you can see that in the chat pane, there are a number of sites, including kidney.ca and the community kitchen there. We can add the dietitians.ca to that list as well. We've had a great question come through about considering an app for this. It is something that we would like to explore further in our future plans, but at the moment it is not available in app form. But I do believe this is mobile friendly. Is that correct, David?
That's correct. It works very well. We haven't found any major bugs yet, so they are available. So the same functionality is available on your phone.
Yeah, and I can vouch for that. I've had a really good test on my phone, and it works really well, and it's very compact and friendly to take on the go as well. I would just once again like to thank our wonderful panelists today. It's been such an exciting time to get to the meal planner to this stage. And I know June has been working on this site for a number of years now. And I know she's just as excited as I am to see this wonderful meal planner come to this this stage. And we'd like to thank all of you for joining us here today. If there's anything further you would like to ask us, please feel free to reach out to the Kidney Foundation. We're committed to providing information and educational resources about the kidneys and kidney disease. We invite you to visit the Kidney Kitchen for more recipes and information about a kidney-friendly diet. Through our regional branch offices, we offer advice and support about accessing services throughout the healthcare system, assisting people to access other supports in their own communities, and offering assistance and skills for self-advocacy. We invite you to connect with us if you have further questions, to speak to someone in your community, or to access any further education materials or resources. Thank you again for attending this webinar on how to use the Kidney Community Kitchen Meal Planner. When the webinar has ended, the computer will open up to a new page requesting you complete our satisfaction survey. We invite you to do this. A follow-up email will be received within about 3 to 5 days with a link to the on-demand recording of today's webinar. On behalf of the Kidney Foundation of Canada, thank you so much for joining us today. Stay well and enjoy the rest of your day. Goodbye, everyone.